being an athlete, as Phil Knight says, if you have a body, you have an athlete. But I did play basketball in college and coached. But I'm really, really excited about this next panel. I think the buzz when we think about brain health, we oftentimes think about concussions. And in many regards, that's very, very important. But we also know here there's so much more to brain health. But this topic is very, very critical. Dr. Turner, introduce Mr. Vickers and the panel. Thank you.
All right, I'm going to invite Jay Vickers to come on up, and the rest of the panel. I know we have Jeff Cummings here, we have Dr. Charles Bernick, we have Sean Porter, right? And we have Dr. Jonas. Come on up. As there's really no introduction, be armed here now, please, for the questions. These are literally the top experts in the field working on this area. So no question can't be answered. Ask it, don't hold back. Let's learn a lot from these gentlemen. Thank you.
Good morning, everyone. Again, I'm Jay Vickers, Chief Operating Officer for UNLV Sports Innovation Institute. And I got to tell you, it is indeed an honor to be here with these great folks and to have the opportunity to share some questions, get some information, and ensure that we can really have some great discussion about brain health and the impact that these gentlemen have made in this field. I'd like to take the time just to introduce a little bit about who they are so you have an understanding of who we have on this stage. And I got to tell you, I don't have enough brain power to be on this stage to be with these gentlemen, but it is an honor to have the opportunity to introduce Dr. Charles Bernick as a staff neurologist with the Cleveland Clinic, Louisville Center for Brain Health. Dr. Bernick has been involved in the field of Alzheimer's disease research and treatment for over 30 years. In 2009, Dr. Bernick joined the Cleveland Clinic Louisville Center for Brain Health, and he has guided the professional fighters brain health study, a longitudinal cohort study of professional combatants aimed at understanding the effects of head trauma on brain structure and function. Next to him is Dr. Jeff Cummings. He joined the UNLV School of Integrated Health Sciences in 2019 as a research professor within the Department of Brain Health. Dr. Cummings is the Joy Chambers Grundy Professor of Brain Science and endowed professorship. He is the director of the Chambers Grundy Center for Transformative Neuroscience and center devoted to using these tools of neuroscience and neurologic drug development to transform people's lives. Dr. Cummings' interest embraces clinical trials, developing new therapies for brain diseases, and the interface of neuroscience and society. Dr. Cummings has published nearly 800 articles and 44 books devoted to neuroscience, Alzheimer's disease, and clinical trials. Thank you for being here. Dr. Jonas Gita, did I say the last name right? Okay. Dr. Gita is a behavioral neurologist and neuropsychiatrist in the Alzheimer's and Memory Disorders Program, and a professor in the Department of Neurology at Barrow Neurological Institute. He is also the director of Dan Cracchillo, did I say that right? And Pam Grant Behavioral Neurology and Neuropsychiatry Fellowship. He is a board certified in psychiatry by the American Board of Psychiatry and Neurology, and in behavioral neurology and neuropsychiatry by the United Council for Neurologic Subspecialties. Dr. Gita's areas of expertise includes brain aging, evaluating and treating executives with stress and memory concerns, mild cognitive impairment, Alzheimer's disease, and related disorders. Thank you for being here. Dr. Mark Norman received a PhD in clinical psychology, emphasizing in neuropsychology from BYU under the mentorship of Dr. Aaron Bigler. He holds a diploma in clinical neuropsychology from the American Board of Clinical Neuropsychology and was an examiner. His clinical work includes epilepsy, multiple sclerosis, traumatic brain injuries, stroke, brain tumors, neurodevelopmental injuries, water procedures, intraoperative brain mapping, and solid organ transplant. His interests include medical disorders affecting cognitive changes, normative data, and demographic influences or neuropsychological testing. Thank you for being here as well. And last and definitely not least, as a sports fan, myself, it's an honor to introduce, better known as Showtime, Sean Porter, who was an American sports commentator and former professional boxer who competed from 2008 to 2021. He was a two-time welterweight world champion, having held the IBF title from 2013 to 2014 and the WBC title from 2018 to 2019. Sean, it's a pleasure to have you here. I'll start off with the first couple of questions, right? We hear a lot about sports concussions or mild traumatic brain injury. Is there a difference between the two? And I'll point that towards Dr. Burdick and Dr. Cummings. You could take that thing off if you want.
There's a lot of, I think, sometimes confusion around terminology: concussion, mild traumatic brain injury, and so on, TBI. And it really shouldn't be that complicated. So concussion or mild TBI, I think we use these terms to reflect an injury to the brain by some traumatic mechanism, where there's some transient brain dysfunction. So somebody could lose consciousness, but it doesn't have to be that. They could be just stunned, dazed, confused, see a bright light. But it's usually, if you look at the brain just grossly, you don't see any changes, and it's thought to be, in most people, a transient disorder. So mild TBI, pretty much the same. There are some definitions on kind of what constitute mild TBI versus moderate TBI, but I think we're talking mainly in the sports world of this mild TBI and concussion issue.
Thanks for that question, Jay. For me, one of the really key aspects of this, and Sean, you might be able to comment on this also, is the repetitive nature of athletic head injury. You know, when we think about traumatic brain injury, we're often thinking about somebody who, you know, is in a car accident, you know, and they have a major brain injury, and their trajectory is determined by their recovery from that. The unique thing about athletics is the repetitive nature of the head injury. It's getting into the ring, it's getting into the game, it's having it occur multiple times during practice, it's having it occur multiple times, you know, during the recurrent events, season after season. And I think what we're starting to see is that there's a different biology of that, and there's a different behavioral profile from that. And I think that's where the research is trying to understand now is, what is the cumulative impact of repetitive head injury? So does that sound right to you?
Absolutely. I think, excuse me, I'm kind of loud. I think that's kind of the key. Speaking with Mr. Burnick and I've been involved with the program, I think, since 2015, 2014. So we've been graphing my brain health for years now. And I feel blessed and elated to say that there's been really no change, no fluctuation whatsoever. I've been extremely healthy through the years of working with him. But the last time we spoke, the conversation wasn't, can it be prevented? It's how do we slow it down? How do we stop it from getting worse? And I think the number one answer to that is, what is your activity like? What is your activity during the course of a training camp, whether that's football, basketball, boxing, of course? What's your recovery? Like I heard you say, what's your recovery after a game, after a boxing event that night of? And I think that when it comes to the athletes and the people that are close to the athletes, the number one thing they need to do is be more cognizant of what you're doing along the way before that big event, and then what are you doing after that event? And that's kind of those are some of the advice that I give other athletes, other fighters, is, hey, it's all about recovery. Stay healthy. If you can't stay healthy, you can't play. If you can't stay healthy, you can't fight. You can't make money, you know? So that's kind of one of the things I really push to these athletes now, is stay healthy. How do you do that? be mindful of the activity along the way, and I think that would help.
That's a great segue, Sean. We're just going to ask that question in detail about what kind of advice do you give other boxers or other combative athletes, but what got you interested in your brain at this level of your career?
Man, I started boxing when I was 5 years old, and I'll tell a long story short. Play football too. I love football, and I just boxed. I'm just an athlete. Came time when I graduated high school, I didn't get the offers that I thought I would get for football. Went to my dad and said, "Hey, I want to turn pro and box." He said, "I thought you were playing ball." I said, "No, I want to box. I want to make money. We know what we can do in the boxing ring." And he bought into that idea. And literally one of the first things my dad said to me is, "We're going to get in, we're going to get as much as we can get, and then we're going to get out. We're not going to spend years and risking your health." And so, I mean, from basically from day one, and of course, my dad being my coach and my manager, my everything, my entire life, he's always had his eyes on me, making sure that nothing was wrong with me from a mental standpoint, a physical standpoint, the health, the whole nine. And so when we turned pro, it was like an unspoken rule, which I think a lot of fighters go through, a lot of athletes go through. I know I can get injured, but I'm not going to. You know, my dad made it. He put it in my face. This is what could happen, and we're going to do the best we can to avoid it. And so I think, you know, along the way, I think once I got involved with you, with Dr. Bernick and Cleveland Clinic, I was kind of bought in at that point. It was like, give me as much as I can know. And I'm going to ask as many questions as I can ask every session, so that I know where I'm at and what I'm doing. And not only that, I can go tell others. So that's what I do now, man. I tell those other athletes, hey, stay healthy, be mindful, get rest, you know, and make sure you recover from it all.
What else
Well,
Go ahead, Dr. Bryant.
No, I was just going to say, I thought you told me that the key to staying healthy is to hit, but not get hit.
I never said that. I never said that.
I was just going to say knowledge is power, but I think not getting hit is also a good thing. With that said, we understand that there's MTBI, Sabao, as well as traumatic brain injury. What's the difference between the two?
Well, I think, you know, again, this is this whole issue of terminology, and really MTBI and concussion, I think really probably about the same. But as Dr. Cummings mentioned, you know, I think it's these more severe types of TBI. So these are the car accidents and the hospitalizations and the bleeds on the brain and so on, which themselves, of course, have a lot of impact in a person's life and how they recover. But I think what we're talking about generally are these milder injuries, these concussions or MTBIs, the terminology.
So the way I think of it is, I will draw a big circle. So that will constitute traumatic brain injury. And then within that, subsets, it could be mild traumatic brain injury, concussion, and other levels. So that's how I conceptualize it. But I think in this context, trauma could be due to sport, due to car accident, TBI due to motor vehicle accident, TBI due to various things. In the context of sport, I think where really the big circle is repetitive head injury, RHI. And the studies that really that we are involved is that we look at RHI and its impact on the brain health. What is really interesting is that some people who will have had several RHI, they don't necessarily have, when we investigate, look at various parameters, we don't see much damage or changes. But of course, unfortunately, on a good number of people, it may have impact. So the flip side is some people are resilient. Why are they resilient? So I think Sean is doing well, looks like. So I think we want to know why Sean is resilient, despite being hit several times on his head. So, thank you.
Not that many, slow down.
Now, we're here and we want to learn more about the effects on Alzheimer's and disease on Black and brown people. We know that Black Americans are nearly twice as likely to develop Alzheimer's disease per the Alzheimer's Association. What is the difference between Alzheimer's disease and CTE?
The CTE work, by the way, I was involved with Dr. Cummings, Dr. Stern, are leading. Dr. Turner and me are part of that team, of course, Dr. Bernice. In that context, CTE is chronic traumatic encephalopathy. It was described primarily at Boston University by a pathologist. They looked, once the person has passed away, they looked at the brain tissue, and the person who had repetitive head injury had some changes in the brain. And these changes in the brain, and the pathologist referred to it as chronic traumatic encephalopathy. Now, this was described back to Dr. Makita and colleagues in Boston several years ago. Then let's go back to 1906. In 1906, Alois Alzheimer in Germany, he had a patient called Frau D. When she died, he looked at the brain, and then he saw 3 different changes. So those changes are a little different from chronic traumatic encephalopathy. So initially, it was described on the pathology, and then later on, we started to understand the clinical manifestation. Typically, in Alzheimer's disease, it is associated with old age, after age 70 or 75, or etc. Forgetfulness for recent events and future engagements, problems with sense of direction, problem with judgment. These are the manifestations of the underlying pathology. So in short, CTE is a pathological condition typically described in the context of sport injury, at least the initial report. And we are trying to understand what is the clinical manifestation, how does it manifest behaviorally, psychologically, cognitive. Thank you.
Jay, may I expand on that just slightly? Because Jonas and I and Charlie are all in the same research project on chronic traumatic encephalopathy. So we have a great collaboration here. Mark, I'm sure you want to talk about this a little bit as well. But we have been studying for 8 years now, 120 professional football players retired, 60 retired college football players, and 60 match controls. Trying to understand this condition that Jonas just described of chronic traumatic encephalopathy. And the important thing for me about this is that there's a group of athletes who have the repetitive head injury that we're talking about that occurs essentially in all athletes, and they have different tolerances for it. And there's a subgroup who develop a progressive fatal disorder. And that's chronic traumatic encephalopathy. And we have to know who that is and what that is and why that is. And this study, which has now been going on for 8 years, is collecting systematically biomarker and clinical data, biomarker meaning brain imaging and spinal fluid and blood analyses, to try to understand this subgroup that goes on to get this extremely serious illness. That's not to underestimate the importance of repetitive head injury by itself, but this is sort of another level beyond that. And that has become one of the major themes of research in sports medicine, sports brain health, is who is going to get, who might get, how can we prevent chronic traumatic encephalopathy?
Thank you, and I think that was, am I on?
Yes.
Okay, beautifully stated, and to kind of highlight a piece of that, we have certainly athletes, and I'll make a distinction here. We have lots of athletes, whether at the very young stages of life and then thinking as people become more elite. And those recreational athletes are very similar because they are athletes, but elite athletes are very different beasts in the way that they're thinking, the way that they're brought up. And so there is a higher risk, especially of those who have repeated hits to the head, those who play in sports or that are higher velocity and for those things. But the real question, as a couple of my colleagues have commented on, is what happens later in life? We see people early on that have acute injuries, and we see, especially with mild injuries, that there seems to be resolution of symptoms. But what happens later in life? Do we have this speeding up of aging? Everybody is aging. All of our brains are shrinking even as we sit in this room because we naturally lose brain cells. But what happens? Why are some people at greater risk of having greater acceleration of aging? And for some, developing this very pathological thing of Alzheimer's disease, which may be a similar type of pathology in the brain, but we're still at the very infancy of really understanding this. But it is critically important, not only to understand for our athletes and for others, but especially for Black men and for Black women, because the biomarkers, those biologic features, may actually be different, but we're not involved enough in research, and I think we'll be covering that a little bit more later.
I agree, and as a former student athlete myself, and others can speak to this as well, is you get asked a question when you get injured. Are you hurt or are you injured? And we've always taught to say, I'm good, coach. You notice we don't answer the question. We just say we're good. And we jump right back up and we go into it, and we call it battle or war. And we're not realizing there's a war on our brain at that time. And so now you're hearing a lot of things. I know for me in the last 20 years as it relates to brain health and injury, and you're seeing certain things such as NFL concussion settlement, right? For someone in this rest of the group that's here, can you describe that process, what's used to administer those neurocognitive tests, and what exactly are they tested for? And lastly, are these the same neurocognitive tests used in research?
Well,
I'm happy to talk about that as a neuropsychologist. So we can make a distinction because there are actually different, there's different testing procedures, there's different determinations. So the NFL concussion settlement has a very specific set of tests and ways that that's approached. That's actually very different than how I would do something clinically. That's actually different than, for example, the NFL has a disability plan. And so all of these things are quite different. And as a clinician, if I have somebody in my office, I'm making that determination. If it's part of a different settlement process, there's actually many more people who have to agree and then make a final determination. It's not the clinician themselves. So generally, the process is different across things. And then one of the other things that's different are what tests are given. Well, there's there's similarities of that. So we always want to know about things like memory. How is somebody's learning? How is their memory doing? How are their verbal abilities, their executive functioning, their problem solving? So these things definitely go across batteries, and we want to see, are there patterns? So something that looks like a head injury is going to look something very different than Alzheimer's disease. And so we do use similar kinds of tests, but the way the determination is made of whether there's an injury or not, or if it's progressive, or if somebody's improving, varies from context to context.
Okay.
Jay, let me just say, when in our chronic traumatic encephalopathy program, we did 2 days of testing. So it was extremely comprehensive, and it had to do not only with the things that Mark mentioned, but also a lot of behavioral testing. You know, what about impulsiveness? What about disinhibition? What about depression? What about apathy? These are all things that are just so important to understand in these syndromes, but it takes a lot of work to collect that information. We also collected information from the spouse or research partner because the person may or may not have insight into their own behavior, right? So getting an external observer was extremely important in the data set that we currently have. I would like to say, by the way, that this data set is publicly available, and it's extremely rich, and it's full of database, it's full of data about biomarkers and brain imaging and neuropsychology and behavior. And if anybody in this audience wants to use it, we would absolutely encourage that.
I think specifically the NFL concussion screening, concussion evaluation, I'm not familiar. So it means really you can be full professor. You don't have to know, you don't know everything. So that's, but I think, I suspect that what, Jeff said earlier, the evaluation we do as part of this Diagnose CTE project, the 7 years project, is more rigorous. So the neuropsychological testing, there is spinal tap, there is brain MRI, various things. Indeed, this is a very good point, actually. Jeff mentioned emerging scholars program who are in this conference that, we have discussed. That could be a very good resource to utilize it. I forgot to mention that to my mentee the other day, actually. That's a good point.
And Jay, you kind of alluded to something that maybe Mark can comment on. It's the testing that was done for, let's say, the NFL or any of this testing, how it differs just racially or culturally. In other words, are people in some sense put at a disadvantage by doing these tests that are normed perhaps on a white population? Yeah. How does that apply? And I don't, I think that's an issue.
I think it's a big issue.
Yeah, I feel like you just pulled my string, and I might go on for several hours about this. And it's certainly been a big discussion, and your point is very well taken. And the issue, there's so many issues entwined in this. And one is that, do the normative processes that we use, do they apply to everyone? And the answer to that is certainly not. But it is a way for us to better estimate how someone is doing. And as I frequently say, a number is just a number, but we have to interpret that number. And one of the problems with that is that we don't have enough information about Black people in our normative data sets. They're predominantly white individuals that are involved with that. And as we've come in the last 2 days to find out that Black people are participating less in research, and there's a host of reasons involved in that, and in particularly Black men. And we talked quite a bit about that yesterday. But this is something, and I'm sorry, you did pull my string, so here I go. So one of the things that we need to do is, this is can be very much addressed, because all you need to do is follow the money. Researchers can't do research without money. But in order to do that, you have to get grant funding. So those grant funders should be requiring that this happen. And in order to get that grant funding, I have to publish. Well, journal editors should be restricting information if it's not inclusive. And so there are things, and researchers, journal editors, grant funders, Black people, to get involved in research. We all have some level of accountability that I think would help our research and our clinical care much, much better.
So I'll add to that. Well said. When you compare that to the fact that most Black men, not most, but 28% of Black men are uninsured compared to the white population. If you had grants that could help the research for Black Americans, would that help close that gap with the lack of insurance? What are your thoughts on that?
I think there's a wide range of issues there. One is that having providers that are similar to the people that we serve. We clearly do not have that in medicine. We clearly do not teach enough about this, or have people who are competent, culturally informed, culturally competent with many things. So I think this is a multi-level issue that needs to come up, that we can better serve and represent the people who are out there. Because I can't do my job if I don't understand the person in front of me. And that takes work. It's not a passive process. It needs to be an active process.
Well said. I'll say this. Most athletes are not as proactive as relates to brain health as Showtime Sean Porter is. And the fact that he had the ability or the thought process to have a conversation with Dr. Bernick and team. If you are concerned about CTE, what do? What's the process? Where do we start? Well,
I would say, of course, the start is really getting information. So learning, but if a person has a concern about it, that they are seeing a change in their behavior, the cognitive function, get it checked out. I mean, that would be really the first.
What are some of those signs, Dr. Bernick?
Well, again, I think as we mentioned earlier, I can't remember who mentioned it, speaking about memory, But what leads to CTE is really exposure to high levels of head impact. So, frankly, somebody who's played, a year or two of high school football is probably not, they're having symptoms, is probably not a big issue. I shouldn't say big issue, sorry about that. It's probably not related to CTE. But in people who do have that exposure from any way, whether it's sports, military, domestic violence, whatever, often the symptoms are first behavioral. So being more labile in their emotions, anger, rage, impulsiveness, things like that, or cognitive problems with memory and other things like that, processing speed and so on. So I think if a person is experiencing any of that, then they should have that evaluated. Of course, all these things are non-specific, as you can imagine. I mean, it could be due to lots of different things in life that have happened to you, other medical conditions. So CTE is not always it's never usually on the top of the list, but it should be evaluated for all these other reversible conditions that could be causing it.
To that one thing, which is that one of our greatest hurdles right now is we do not have a test for CTE, and that's been, I'd say, a disappointment of our research, is that we have looked very hard at blood and CSF and all sorts of different brain scans, and although we have a scan for the protein of CTE, the particular scan we have doesn't stick to exactly that protein in CTE. So we have been defeated in all of the ways that we thought we would be able to come up with a diagnostic test. Well, without a diagnostic test, it's very difficult to know who is on this trajectory. So it really is something that we have to solve. This particular research project, by the way, has a 40% representation of Black athletes in it. So I'm very proud of the fact that Black athletes came forward and that we were able to include them in the research project. But we are going to have more research because we lack this biomarker, and we're going to have a representative representation of athletes across the spectrum of athletes who really play this game.
Well, I want to add to that real quick is part of that research that you're talking about and having 40% Black Americans be a part of it, I think it's also about you being proactive and reaching out to those Black athletes and giving them a pathway to come in to be part of that research. I know from talks with Dr. Burnick and yourself, you've made a point to try to reach out to those athletes, just like Sean Porter. So Sean, I know you're hearing all these different pieces on CTE, not having correct testing, things of that nature, and you've been very successful in your career. So I see you, and like I said, it's an honor to be on the same stage with you. But what are your thoughts on it when you hear the negative talk about CTE and sport concussions? And is there a concern for the sport that you love?
I think that it comes with the territory. My favorite sport is football. So when I noticed them changing the sport and you can't do what I grew up seeing, I'm not going to say that because, the football we see now isn't exactly the football that it used to be. You have to readjust your mind. And I readjusted my mind to this game is still fun. It's just not as vicious. It's just not some things that aren't allowed anymore, but for good reason. Me being a professional athlete, I understood. So it's a little bit easier, I guess, for me to accept. And I think that that's the thing. You have to accept that there's viciousness that comes with sport, even with basketball. I mean, you'll dunk a ball, and some of those guys, the way they dunk the ball is this energy and this viciousness that's just like knocking somebody out. There's a viciousness that comes when you hear knock out, but it's really no different from a big dunk that just changes the energy in the game. It's the same thing. So I really just think that I feel that people need to understand the territory and what they're watching. Understand that it's time for change in every game, every sport, to make it safer, to make it more enjoyable, and for the longevity, not only of the sport, but also of the athletes. So I really, I want to see change in my sport. I think that the fact that my sport hasn't changed, I think that honestly is what keeps bringing people back to the sport. They know that they're going to see a big knockout because this guy is known for, he's got 30 wins and 28 of those are knockout. They know what they're coming to see. The people who don't watch the sport, they look at boxing as being a vicious sport. Why would you do it? I even, as a participant in the sport, I've said that, why do people like this? But I promise y'all, like, I retired in 2021. I started having those thoughts around 2019. And I was like, all right, it's about time for me to go. Because when you start thinking that way, it changes. It could alter what you do in the ring, and I didn't want that to happen to me. But what I always do is I bring people back to understanding, hey, you saw the big knockout, but that's why I do my podcast. Let me narrate and orchestrate and show you guys how that knockout happened. Let me tell you guys what he was doing round after round to really set it up. It becomes art. It becomes science. It really does become a beautiful dance and dancing partners when you really get to the core of the X's and O's of the sport. So that's kind of what I do, is I try to get people to not look at the sport as just being this vicious, we fight. That's another thing. If you guys really pay attention, outside of the ring, we're all friends. You'll see us hanging out, and you'll see us enjoying one another. And you get to a press conference, and you guys may expect us to be cussing and to, really be going at each other's throat before the fight happens. You usually don't get that. There's more respect in boxing than you see in a lot of other sports, because that's kind of what comes with it. We know we're out there get the best of our guy that night. If he gets the best of me, wow, you showed everybody that you were better than me. Even me, I have to respect you for that. So I think that to answer your question, all in all, when it comes down to it, is I think that if this sport doesn't change, it will be in danger, because the CTE that comes from it, the damage that comes from it, and no one looking after the fighters, is going to be something that's continual. And it's we can go as far back as Muhammad Ali, and he serves as the stamp on what could happen to you as a fighter. And I'm trying to be a representation of what you can be if you take care of yourself, and if you pay attention, if you're real with yourself, the way my dad was real with me from the beginning to the end of your sport. So that's what I try to do now, man. I just try to be a good representation that this sport is vicious, but it's also beautiful, and you can be safe doing it. And at the end, you will be able to have a good, healthy life.
Sean, having the ability, thank you for that. Having the ability and the platform that you've created for yourself, but also to speak about it in the form of science, in the form of a dance, does that help you with your mental health as relates to the sport?
Absolutely. I think when I was starting to retire from boxing, I started to get into other things. I had started the podcast, the Porterway podcast. I know you guys were wondering. It's the Porterway podcast. Search and follow us, all that good stuff. But as I started getting into those things, I literally started to recognize this is like the training that I was doing for my muscles, for everything to work on fight night. Now I have to train the mind. I have to continue to keep the mind strong. So I'm not going to go into everything that I do, but I definitely attack it in a sense of repetition, strengthen. Don't forget. Keep working. And I do believe that the things that I do now are continuing to keep my mental health and my brain health intact and stronger than ever, hopefully.
Based on what we hear and see about athletes, obviously Showtime here has really been very proactive in his approach to mental health. But you should know African Americans are less likely to use mental health services than white Americans. However, African Americans are 20% more likely than the rest of the US population to experience severe forms of mental illness, depression, PTSD, ADHD. what advice do you have for black men in our audience, both here in person and virtual, about seeking help for mental health issues?
I think in terms of your question is about seeking mental health. And then earlier also you asked a football player or other sports person, when should they be concerned about CTE? So there are, Dr. Mays, who is part of our team, he has published a paper that players, football players, American football players who played 11 or more seasons are at risk. But this is group average, really. Each individual is unique. So if I'm a football player, if I played 12 seasons, I should not get up tomorrow and freak out because it is group average. But I think more importantly, as Jeff mentioned, if the spouse notices that a retired football player who has always been, respectful, cordial, suddenly shows explosive behaviors again and again, that's one thing to be concerned and to seek help. And the other thing is if the person notices also significant functional decline, then that's when to seek help. So I think the key is that's where the spouse and the black man would work together to really address problems. In terms of seeking mental health, the issue of stigma is a problem for everywhere, but it is more so. It is more so, I think, in the African American, in the minoritized community. And there is a lot of historical reasons. Part of the problem, part of the challenge is that if there is a mental health service delivered and advanced by people who look like them in the community, probably they are more likely to seek help. And yesterday, Monica was saying when she was a child, she was interpreting for her mother who was not English speaker. They used to be terrified of going to a big hospital. Imagine if there was a health care provider close to where Monica lives who looks like them, integrated in the community, they are very likely to seek help. So I think part of this conversation of training the future generation that Dr. Turner and Dr. Monica are doing, that's one of the key factors is really we need to have mental health care providers who would be available to the community and also advancing it in public media in various settings as well. Thank you.
Dr. Gidi, you touched on probably my next question, which is there's a unique set of social issues that minorities have, and as far as Black Americans, females, so just I'll direct this towards you, is as a Black male clinical psychologist, how do these issues shape your approach to treating Black Americans patients? What do other clinicians need to be aware of when working with the Black male community? Yeah,
I think maybe I can do that in reverse order. A lot of this is about feeling understood. And it is hard. It is impossible for me to explain to someone who's not a Black male what it's like every day to experience being Black. Every time if I go into a store and I notice somebody following me, many of you have never thought of that before. I think about it every day. And there are both historical and real-time traumas that exist. And some of my colleagues were talking about that yesterday. And Dr. Stroman and I had an impressive lecture by our Lyft driver on the way here who was explaining what it's like every day to be a Black woman and be traumatized by the riders in her car and what they say to her. It was amazing. And so if you don't understand those things as a provider, it's hard to make that connection with people. It's hard for the person in front of you to feel connected and be able to speak in a way that's not having to fully explain everything about being Black to someone who's maybe not going to understand that. And I don't want to make sure and explain, this is not just about being Black, it's about understanding other people, whether I'm working with someone who's Black or who's Latino or who's Asian. And so there's an aspect of understanding people and being able and willing to listen and learn. And then, of course, there's all these issues, not only around being Black and seeking mental health care, because that's just not something we all grew up doing. But then it's also different being an elite athlete, where being vulnerable and sharing things is not part of the culture, because that is a culture within a culture. And so there are a lot of things that we still need to understand. But in working with elite athletes, it's actually even different. There's more things to learn and understand with that. But I really encourage people to understand.
Anyone want to add to that question at all?
I think the most critical thing is that the empowerment of the communities is critical for the children of a particular community to seek help. They need to be empowered. I think the community-based research that we have been talking about, these are the things that will lead to the clinical care, translates to clinical care through translational research. So I think we have to, at a society level, at a family level, at individual level, we have to do several things. So, so I think I would say, since we are here in this context, probably the Emerging Scholars Program and various things, and the research being done by our team and various things, we have to have really specific, concrete interventions at a society, at a national level, I think, to address this. You raise a question, the question you raise is really a public health problem. What is public health? The unit of intervention in public health is at a population level. The unit of the intervention at the clinical level is at an individual level. So this, you raise a public health issue, it should be addressed as a public health problem. I think Dr. Stroman's talk earlier talks about that. By the way, I picked up vocabulary. I didn't say minority, I said minoritized. So this, the first day I learned something today. So I think it's a public health issue. It should be addressed as an issue.
I'd just add one thing to that, Jay, because you mentioned that Black men are about 20% less likely to have insurance coverage.
Yes.
So just sort of at the basic level, to be able to go to the doc, that has to do with, insurance coverage from employment or from non-employment circumstances, or some way to have, the means to get to a healthcare professional.
And I would, by the way, just echo that, because in our study, which are primarily boxers and MMA fighters, interesting, a lot of people are open to seeking help. So I understand there are a lot of people that aren't, but people are open, but they don't know where to get it, or they can't get it because they, particularly in boxing, where you're independent contractors, once you're out of the sport, it's not like the NFL. I mean, you have no safety net. And a lot of these people, don't have anything else, really any other skills, in some sense, not, you're excluded, but it's a tough issue. So I think it's the one issue of that seeking the help or being vulnerable to seek the help. But the other is, just like Dr. Cummings said, is you just can't get it even if you want it. And I think that's really a tough issue.
Well, thank you all for answering these questions, but we got about 7 to 10 more minutes. I'd like to see if there's any questions from the audience. Oh, we got several questions from the audience. Let's see how we'll orchestrate this. I think you're grabbing over here to the left. We have several folks if we have a mic.
Hi, I'm Joshua Owens from the University of Florida. So kind of like in aging research for the past couple of decades, there's been this growing popularity in looking at social determinants of health and how environmental factors can put you at greater risk for entering late life at lower cognitive levels and cognitive decline. But it seems like in concussion research and CTE research, there's been this kind of lag in examining some of those social determinants of health and how environmental factors might be interacting with both recovery from concussions and putting you at greater risk for CTE. So correct me if I'm wrong, if I'm missing something, but I was just wondering why you think that there's a lag in that domain and where you see kind of like the future going.
This question is actually for Dr. Turner because he is studying this question. The very question you raised as part of diagnosed CTE, he's studying it. Maybe would you like to comment, Dr. Turner? Okay, okay.
I would say you're right on, because in our project and in the diagnosed CTE, people are now starting to look at it. I think the problem is, one, there aren't that many studies. There's very few longitudinal studies with this whole issue of long-term effects of repetitive head injury. Second, I think people that designed the studies probably didn't think about that initially, but now they are. And I think this information hopefully will be coming out, but there's just a real paucity. Because we looked at it, I mean, to see what's in the literature for this. There isn't anything. I mean, and it's a critical issue as you brought out.
And I think if I may, we're still early on, and I think this is the kind of start that we need, is by having this kind of conversation. And I think I'm grateful to the funders and the help from the National Institutes of Health and Alzheimer's disease and related disorders for being able to lend support, and others for the NFL, the players, the alumni, and others for giving us the opportunity to talk about these things. And I think some of the databases that are being discussed now in terms of Alzheimer's can be a starting point for us to look at the athletes that are there and what actually happens. So I think this is a wonderful start to that, but I absolutely agree that we're still early on and we don't understand the things that you're talking about, especially in terms of the social determinants of health.
Hi, thank you for your wonderful, wonderful panel and speech here and the information. My name's Philip Griffin. I was wondering, I haven't heard, is there studies being done or have you considered studies on athletes directly after a game or a match, so that they can get a brain scan? I went to the University of Delaware, and here is the stadium. You have to actually go by the MRI imaging center to go to your dorms. So I thought that might be a excellent place. Again, if not the NFL, because there's more players actually, in college, and then you can follow along these specific ones, running backs, for example, until they're 25, 26, or 30, and monitor their the progression, if there's anything like that.
I'll start. I'm working on some things right now, and pertaining to that specifically, we see there'll be 8 matches through the night. Not all 8 matches go the same. Not all 8 matches end the same. But in the case where a fight is, a fighter sustains, well, we know to be, hey, that was a hard night for you. You fought all 12 rounds, but it was every single round was hard. I think that someone should be put in a position to check on that fighter day after, 24 hours, 48 hours after, a week after. And if there's any signs of anything, let's get you tested. I agree with you. After a game, if you got to go past the MRI hospital, why are we all driving by? Why isn't this guy who we know stumbled off of the field, why isn't he taken into extended protocols? So I think, especially with the NFL, I mean, they got immediate protocols now. I think boxing needs some protocols where there's something put in place where there's day of, 24 hours after, 48 a week after. Me personally, I think that is something that could help because football players, they play every week, and so there's your point right there. If you're playing every week, let's make sure you're good going into this next week. I think extended protocols are necessary in every sport.
And I'll just add one thing, which is we're in this tremendous era of biomarker discovery for blood biomarkers. And the sensitivity of the techniques are now so great that when a nerve cell is injured and it leaks part of its contents into the blood, we can see it. And that blood is starting to be collected after the fights now, after the games. I think we're going to have a lot of insight based on these blood-based biomarkers, because easier brain imaging is a lot easier than a lumbar puncture, and it's readily available. So we don't have the information we need yet. We have a few studies, and Charlie, I think you've been involved in some of those, but it's now possible to do it on a very large scale.
Hi, my name is Rachel Grashow, and I just want to thank the panel for their care and their work. I'm here on behalf of one of the largest longitudinal studies, I see what you're saying about longitudinal work, on former NFL players. And I want to say that, you know, while CTE remains elusive, while we can't find a biomarker for living in life, I think we have to ask questions about what are the cascade of health events that occur between the head injury and the eventual CTE discovery post-mortem. And I think what we're finding is that there are a lot of conditions caused by head injury that haven't really gotten a lot of attention because they don't necessarily relate to cognitive issues. And we're finding that head injury leads to, especially repetitive injury in former players, it leads to sleep apnea, it leads to depression, anxiety, it leads to hypertension, which we know Black men are incredibly susceptible to for societal reasons, discrimination, medical racism. So there's all these conditions that we know are related to head injury that haven't really been looked at, that are on the pathway to cognitive dysfunction that paralyzes players with fear, right? And that keeps them from getting treated for, again, sleep apnea, hypertension, low testosterone. So there's all these conditions that sort of lay in the middle of this cascade that I think we can go after as a group, and specifically that affect Black men, that I think will allow us to save lives, improve quality of life, healthcare, quality of life, you know, all these pieces while we wait for that CTE biomarker and while we wait to understand what are the clinical implications, what are the precursors. We don't have those yet. And so I just want to say that I appreciate that everyone in this room is going after how do we take care of the guys while they're alive too, right? So thank you.
Probably have time for one more question.
Back here.
Annette, I think that's a great point. You know, I'm a neurologist, so I tend to be, you know, an above the neck guy. And of course, we have to think about this in a far more systematic way than we have so far. So that's a really terrific point.
And I think if I may comment, this type of questions has been raised in Alzheimer's disease research. So I lived many years in Minnesota. We have a population-based study of aging. So we started out with dementia, and then we said, okay, there are some people who don't have dementia, who are not normal. They forget their flight to New York City, not misplacing keys. And then we started to study those people. And then eventually, in fact, even we should study people long before they develop symptoms. And of course, we took age as a risk factor, and we took people 70 years and above, men and women equal number, about 2,500 people. We followed them forward in time. We are learning a lot. So I think a similar approach to what earlier was asked, you know, when they play, you know, but we should not probably wait for 20 years until they retire to study. Maybe protocols, extended protocols or other means of studying things early before these events happen. I think this is a very good point, but I don't know the answer. I don't know how the field is in this area.
Well, I'll just add something really quick, because I think as researchers, one of the things that probably would accelerate our knowledge is to see if we could somehow collaborate or combine data sets. You're doing NFL, we have athletes, boxers, MMA, motor sports, hockey players. And I think we, as a group, and maybe CTE is a good example of how maybe we as a field can actually really work together, as they did in Alzheimer's disease, to get these answers sooner.
Last question.
Yeah, so the first thing that I had was kind of a comment addressing the question about research being done immediately after concussion. So there is a study, I'm sorry, I'm Eliana Varangas from the Michigan Concussion Center. Sorry, I should have mentioned that first. So there is a study called the CARE study that actually collects data within 24 hours of concussion and then at several points in the recovery process. And they collect neuroimaging data, cognitive data, as well as, I believe, some blood-based biomarkers. And so I think they're starting to kind of publish a lot of these data, but I think it's such an important point about kind of capturing that immediate recovery period that's so important. So first, I just wanted to mention that. The second question I have was kind of piggybacking off the first question about the other determinants of health that could impact your risk for things like dementia. I think there is a lot of consideration of kind of the potential negative impacts of different aspects of health that could impact risk for dementia. But I also wonder, in the field of aging, obviously there's so much research concerning things that can protect against cognitive decline and progression in aging. And I think I haven't seen as much of this work in the field of concussion. And so I'm curious to hear how we can maybe tailor some of those like interventions that we do to promote cognitive health and aging to specifically a former athlete population, and how we can best serve these former athletes to help them protect their cognitive health in aging.
I think it is, the only difference is really age is a key factor for Alzheimer's disease. Age is the number one risk factor. So we can really pretty much modify this to the sport world. By the early manifestation, psychiatric symptom, depression, anxiety. In fact, until 1994, we were not really studying depression, maybe depression, anxiety a little bit, apathy, disinhibition, aggression, 12 behaviors really, until our colleague sitting right here, Dr. Jeff Cummings, came up with a scale called neuropsychiatry inventory. It really changed the field. The focus before that was, we focus on MRI, we focus on cognitive, and really behavior were kind of overlooked or avoided or suppressed or whatever. But now we are looking at these things and we measure these behaviors in normal people, elderly normal, and in patients and athletes in this study in Diagnose CTE, we measure those 12 behaviors and additional other behaviors as well. So we are making progress along that line in terms of the behavior, but here I am sitting next to the person who developed it. But I have used his scale so many times, it helped my career too.
And thank you for those comments. And going back to your question, I think in some sense as researchers we need to take a bit of a different tact in some things, because the social determinants of health are different between different groups of people. And so if I want to purely know something about Alzheimer's disease, we exclude lots of people. And so we're doing a study right now with Black women looking at tau and risk for Alzheimer's disease. And we have to recognize that the same biomarkers are not the same. And we can't just exclude all Black women who have diabetes. Like this, it becomes rather absurd. Of course, that's what our grant funders want us to look at, but we need to be inclusive and actually understand our population and looking at these social determinants of health. And as you said before, it's important to take care of your health. And I would say it's not only your physical health, but your mental health also, because that will keep you playing, that will keep you engaged. And we need to take a larger approach to things and looking at all of these factors.
Wow, what a panel. Let's give them a hand. Dr. Norman, Dr. Gita, Dr. Cummings, Dr. Bernick, and Showtime Sean Porter, thank you.